Hypoglossal nerve, that is the muscle supplying the tongue. Except the palatoglossus nerve that was supplied by the vagus nerve, all of the muscles are supplied by it. Its nucleus is present in the near the midline. Journals, it's like the journal somatic efferent types of fibers. It's lying in the medulla near the midline, near the fourth ventricles, and it receives the corticobulbar fiber from the both sides. However, the part of the nucleus that is supplying the genioglossus, the muscle responsible for the tongue protrusion, that gets signal only from the contralateral side. You can see contralateral side. All of the others are supplied bilaterally. So any lesion in the higher areas will lead to the upper motor neuron type palsy of the genioglossus, while the rest of the muscles will survive. This originates from the hypoglossal nucleus. Genosomatic efferent leaves the skull through its own canal, glossopharyngeal canal, moves in the carotid sheath between internal carotid artery and vagus, but soon leaves it anteriorly and it goes to the tongue. There are it goes to the tongue. It receives also joints. I have discussed it in my neck lecture that it does receive fibers from the C1 fibers from the cervical plexus, and it helps in distribution of the C1 fibers to the ansa cervicalis, anterior limb, and to the infrahyoid muscles and some other muscles also. But majorly as it moves on, it supplies all of the muscles of the extrinsic muscles except palatoglossus and the intrinsic muscle, all of them. It has a few branches, the meningeal branch that go back and supply the branches, the descending branch that makes the ansa cervicalis anterior branch, but it's technically not the branch of hypoglossal nerve, it's the C1 fibers that were hitchhiking along the pathway. And then there are muscular branches get this by all of the muscles and the nerve to genioid that goes in the end. In the upper lower motor neuron type lesion, ask the person to protrude the tongue, ask the person to stick out the tongue. The tongue will deviate towards the lesion side. The tongue will lick the lesion. The tongue licks the lesion. Tongue will deviate towards the paralyzed side. If there is upper motor neuron lesion, only genioglossus will be paralyzed on the side contralateral to the side of the lesion, and no atrophy and the lower motor neuron type palsy features will be seen. So that's it. That is it. You are done with the cranial nerves. These are the few reflexes we had discussed. We discussed the corneal reflex, afferent limb, efferent limb, lacrimation reflex, afferent, efferent, jaw jerk reflex, both for trigeminal, pupillary reflex we discussed, gag reflex we discussed. These are the MCQ questions. These are the few MCQs I am leaving with you. You can pause the video here. For the live people, you can go back, read the MCQs, try to solve maximum of them, and in the next slide, I will give you the answers. These are some more MCQs. Pause the video here, go through them MCQs, try to solve as much as you can, and then the answers will be provided to you. So that's it. Thank you so much, and thank you for staying with me online and giving me support. If you have any questions, please do mention in the comments. I will try my level best to answer these. And do let me know if there is issues with because I was recording it live and I think I had encountered some issues with the connectivity. So I will upload a local recorded version also. If you have any difficulties, please let me know for in case of any suggestions and feedbacks and subject related queries. Thank you so much. See you in the next lectures. Till then, good luck, good night, Allah Hafiz.